Good morning everyone. You are watching Dr. Priya's lecture classes. Today we are going to discuss viral gastroenteritis. So we will discuss today viral gastroenteritis. Okay. That means some viruses are there which will cause irritation and inflammation of gastrointestinal mucosa cells. Okay. So there are two types of viruses. So we will divide the viruses into two groups, RNA viruses and DNA viruses. Most of the viruses are RNA viruses, few viruses are DNA viruses. Among DNA viruses, adenovirus 40 and 41 are important. Now, the age groups at risk. Depending upon the age group at risk, we will divide these groups into two broad categories. Okay. Depending upon the age group at risk. So we will write here age group at risk. We will divide it into two broad groups. Some of the viruses which infect only children less than 5 years of age. Some of the viruses which will infect all the age groups. So depending upon that, viruses which infect only children less than 5 years of age, and some viruses which infect all age groups. So the viruses which infect the children less than 5 years of age. There are 4 families of viruses. 4 families are there. Number 1, Reoviridae family, Calciviridae family, Astroviridae family, and Adenoviridae family. Okay. These 3 families are RNA families because the genetic material over here is RNA. So these are RNA families. And this adenovirus is of DNA families. So here from this family, Reoviridae family, the important virus is Reovirus, which will cause viral gastroenteritis. Similarly, from Calciviridae family, 2 types of viruses are there, norovirus and sapovirus. From Astroviridae, astrovirus, and from Adenoviridae family, adenovirus. Okay. Now the RNA over here is double-stranded RNA. Here single-stranded RNA. Here single-stranded RNA. Here also single-stranded RNA. But here the DNA is double-stranded DNA. Okay. Now, one important thing is there. What is that? That is this norovirus. Norovirus causes gastroenteritis not only in children but also in adults. So we can write here among all age groups here norovirus under this heading from Calciviridae family. Okay, so we all know that the treatment of viral gastroenteritis is first oral rehydration, therapy, giving plenty of fluids per mouth. In case of severity, we can give IV fluid. Okay. No specific antiviral is there. So no specific antiviral is there. So we will give the only conservative treatment we can give. Now we will discuss in detail about rotavirus, because this virus causes most severe gastroenteritis among children. Most severe gastroenteritis among children. Okay. So neonatal infection is common, but that is less severe. So the rotavirus will infect children less than 5 years, and the peak incidence are found between 4 to 23 months of age. Okay. They can infect neonates, but the infection is common but less severe. Common but less severe. Okay. This type of viral infection is seen in winter months. So common in winter months. Okay. So that is transmitted by fecal-oral route. So the stool of the infected child can contain as much as 10 to the power 7 to 10 to the power 12 viruses per gram of stool. Okay, and that subsides within a week. Okay, and involvement of other organs such as respiratory organ can be seen. So the virus can be found in respiratory secretion. So shedding in respiratory secretion, person to person contact, and through contaminated surfaces. Okay, there are 3 types of rotaviruses. So types of viruses, 3 types of rotaviruses are there. Types of rotavirus. They are classified as Group A, Group B and Group C. Among Group A rotaviruses, 10 serotypes are there. Among them, 5 serotypes are common. What are those? Those are G1, G2, G3, G4 and G9. Okay. Group B rotaviruses are not such common. In the history, large epidemics in China were caused by these Group B viruses. Okay. Group C viruses are there, but they will not infect like Group B virus or Group A viruses. Okay. Associated with many other syndromes. So, association. With number 1, sudden infant death syndrome. So we will write here sudden infant death syndrome. Sudden infant death syndrome. Number 2, necrotizing enterocolitis. Necrotizing enterocolitis in children. Enterocolitis in children. Okay. Number 3, intersusception. Number 4, Kawasaki disease. Number 5, type 1 diabetes. Okay.